The cancer burden in Tanzania is increasing. At the moment, we expect to see about 35,000 new cancer patients a year. And the types of cancers that we see in Tanzania are different from the cancers that are seen in developed countries. For example, in women, cancer of the cervix is the commonest cancer, whereas in developed countries, cancer of the breast is the commonest. When you look at the males, we have a big increase in Kaposi sarcoma, which is a HIV-related cancer. And then this is followed by head and neck cancers, esophagus, and the lymphomas. The HIV-related cancers have been on the increase in the recent years. The biggest challenge is number one, resources, number two, resources, number three, resources. Resources in terms of financial, human, and even infrastructure. The health systems in a country like Tanzania is geared to addressing communicable diseases rather than non-communicable diseases. Most of the funding in the health sector goes to communicable diseases, things like malaria, TB, and HIV/AIDS. Cancer is not in the health agenda. One reason could be there are a lot of competing priorities in a place like ours. At the moment, we in Tanzania are working on our cancer plan. That is the starting point. And I strongly feel that with a cancer plan in place, it will be easy now to be focused and be able to implement those activities which are within the available resources. In our cancer plan, we are going to be addressing the whole range of the activities like cancer prevention, and that will be through health education, and for those preventable cancers with the vaccination like the human papillomavirus vaccine, which is just available, or hepatitis B vaccination. And then the next thing would be early detection and screening, especially for cancer of the cervix, using low techniques like visual inspection with acetic acid. And for those that are already invasive, improve the treatment modalities for cancer, which include surgery, radiotherapy, and chemotherapy, and at times hormonotherapy. And then for those which are advanced beyond cure, we need to have good palliative care service in place. So in our plan, we're going to address the interventions that deal with those four main components. International organizations such as International Atomic Energy Agency have a big role to play in assisting countries like ours to build the capacity which is required to be able to implement any plan. The capacity building could be in terms of human resource training, also in sometimes acquisition of the needed equipment. You know, cancer treatment is very expensive and capital intensive. A treatment machine, a very simple one using just a cobalt source, would cost about $800,000 US. That is a lot of money, and whenever you get international organizations that are willing to work with you, they can always find means and ways of assisting countries like ours to make things like treatment with radiotherapy a reality. One, and that is very important, is to have the political will. You need the policymakers to put a policy in place that would address cancer issues like the way we address HIV, AIDS, malaria, or TB. And secondly, although we have few resources, cancer should also get a share of those resources. And that will make the country own whatever services are available in the country. It is going to be able to sustain even those services that are assisted by other organizations. We need the resources in terms of human resources. So I would wish that we have training opportunities to train people who are going to implement the activities that are in our cancer plan or are going to be in our cancer plan. We would need resources in terms of finances. Without money, you can achieve very little. And finally, development of the infrastructure, the health services systems, so that there is a good referral system for patients, and also facilities are available for screening, diagnosis, and treatment. This should be available where most of the people are, that is in the rural areas. Right now we only have services at national level, but you can't expect all Tanzanians to travel to Dar es Salaam for treatment. So we need to send these services to other parts of the country where it is a bit nearer for patients to access the services.